everybody. This is Greg. Greg, this is everybody. So go ahead and tell everybody what we are dealing with today.
I have Achilles tendonitis.
And who diagnosed you with that? Ortho?
Yeah, orthopedic.
Okay.
I don't remember his name.
Okay, no problem. When did you see him?
Like a week and a half ago.
Okay. What caused it? Because you'd never had this before, right?
Not on this side.
Okay.
Excessive exercise.
What exactly were you doing that made that flare up?
8 minutes of calf raises,
Okay.
a bunch of sprints, and ran 4 miles.
In one day?
2.
2 days, and then that third day,
It was messed up by the second day.
Okay,
and I
so you
just kept
kind of pushed through it a little bit.
Yeah, pushing through it.
Okay, how does it feel right now?
It doesn't feel very bad right now, but whenever I don't have it taped or wear a boot for like a day and a half, it flares back up.
Okay, so are you wearing that boot right now, back
No,
at the
I
house?
had it taped yesterday,
Okay.
and I was going to tape it again today because I have to be active.
So you're not wearing the boot anymore, right?
No.
No boot. Okay, awesome. The first thing I'm going to do is I'm going to check his dorsiflexion. So I'm going to have you lay on the table face up with your feet right here. You can lay all the way back. All right, I want you to just give me dorsiflexion with both of them. So as you can see, this one, he has a lot more dorsiflexion than what he does here. So the goal for today's session is to try to get that evenly as much as possible. So we're gonna do a little bit of soft tissue work to this antib, post-tib, gastroc, soleus, and we're also gonna work on the plantar fascia because the Achilles is here and it comes down to the heel, so everything's gonna be affected. All of this, all the way up to here. Another thing that I wanna look at is his big toe mobility. So, just gonna move this one here. It's good, not bad. Not horrible. He has a little bit more on this side. And then just for a close-up for the dorsiflexion, go ahead and give me dorsiflexion again. So there's a huge difference here. Yeah, that's good. Okay, we are gonna start him face down, okay? So let's get your face down. Bump up his ankle so that his knee isn't in extension. Okay, now I'm just gonna warm him up a little bit with a Theragun right here. Sorry. Just a little bit before I start doing some manual therapy and myofascial release. I just want to warm him up. I don't want to jump right into it, especially because tendonitis is a lot of inflammation.
Yeah, there you go. Perfect. Yeah, we're just trying to get your butt as close to your heels as possible. There you go.
So a good thing is that there's not any difference in these Achilles. It's not swollen. Normally, if it's really, really bad, this thing will start to get a little bit of swelling in it, but there's not too much of that. So that's a good sign. So we're just gonna get all up in here.
Perfect. 3 more. And this should help just give you a little bit of relief too. 1 more.
Do you have imaging done, or he just kind of self-diagnosed?
He self-diagnosed. I wore a boot for, my GP told me to start wearing a boot. I wore a boot for 2 weeks, and then I've had it taped for a week, and I'm on still on prescription anti-inflammatories.
You're still on them?
Yeah. I don't know what they are. And he said he could feel a difference, but I guess it's improved.
All right, good. So we're gonna go to the turf.
How's your range of motion? Go down and touch your toes? Look at that.
I don't feel
Look at that.
the same.
Yeah,
That's
you're just
funny.
tight.
That's perfect.
Myofascial release.
So now we're gonna do a little bit of loading on the back now too. But nothing crazy.
And I'm just hitting all of this here, all the way up. You're pretty clogged up right here. I don't know if you feel that. Yeah. Sorry. Here specifically, you can feel that tissue feels different than the rest of the tissue. So I'm going to put a little bit more emphasis here. So if you zoom in right here, I'm going to start to slide up his Achilles, and when I get to a certain spot, I'm going to see a little bit of a spasm, hoping that it comes back on again. Not there yet. There we go. So that's normally an indicator that there's something going on in that spot. So same thing, a little bit of trigger point therapy. I'm gonna stay on there for a while. It went away, but every here and there I'll get a little spasm. Can you zoom in on that, Joseph?
I can feel it.
Yeah. It literally just glides under my hand and slips away. All of that. So anytime there's Achilles tendonitis, tendinosis, anything like that, the calf, the soleus, the gastrocnemius are going to be super, super tight, which is going to limit your ankle dorsiflexion, just going to cause a lot of pain. So I'm not a fan of the rice method. The rest, ice, elevate, compress. I'm a fan of loading. Maybe for that first 36 hours, I would say if it's madly inflamed, yes, use ice, but I want to minimize the use of ice as much as possible. I want to do myofascial release, manual therapy, break it up, and I want to start loading it because your tendons and your tissues love load, okay?
Lightweight.
Yeah, nothing crazy. And it's normally a biomechanical thing as well. If the foot is not working properly, it's going to throw all of the biomechanics off.
Just like doing calf raises for 8 minutes.
8 minutes straight, no rest, nothing?
Well, I wouldn't be able to do it for 8 minutes. So like I would fail, and then I would take 15-second break, and then right back into it.
Okay. Standing calf raises, body weight, with weight on the machine?
Body weight.
Okay.
But on something so I could break.
Elevated, yeah. I'm gonna get in that thing as much as possible. He doesn't have pain here at the heel, so that's a good thing, but I'm still gonna hit his plantar fascia in a little bit. Just getting up and under that Achilles. And work down. Then I'm going to do some active movements where I'm here. And I'm just passively doing some ankle dorsiflexion. So now I'm just going to do a little bit of passive range of motion here. And then now I'm going to have you do this movement on your own, okay? Want him moving as much as possible. Movement is medicine, motion is lotion. Now I'm going to do a little bit of ice stim. I have a rock blade here. I'm going to keep this under 3 minutes, and I'm not going super hard. I'm just going to... There's no point of digging into him like crazy. A lot of therapists do that out there and make us knowledgeable therapists look really, really bad. Stop beating up your clients with this. That's not the point of this. This only gets to the superficial layer of the tissue, so there's no need for me to ground and pound on him. That's not effective. That's not what we're trying to do here. Just trying to stimulate some blood flow, get a little bit more collagen producing, fibroblastic activity. Keeping this under 3 minutes. I'm just hitting that entire gastroc, soleus, calf. I'm gonna do a little bit of feathering on the Achilles in a little bit, but I'm just keeping this under 3 minutes. I'm not trying to kill my client. That's not what we're doing here. All I want is more range of motion. Bit of a feathering technique around the Achilles. And I'm also gonna do a little bit here to that bone. I'm not gonna do anything crazy because you wanna be careful with that, but just a little bit of feathering right here. I can also come on this side and do some little mobilization and get under that Achilles. How's that feel? That feels okay? Just to get all, you good?
Yeah, I just want to see.
Huh?
Yeah, I just want to see.
Don't worry. When this drops, we'll tag you in all of it.
Well, I don't really have any social media. Just text me the link.
Just very, very light over here. It doesn't hurt to get on the bone, but obviously I'm not gonna jam away at it. Just a little bit of feathering. Come on the medial side. So now I'm gonna start working on the plantar fascia because that Achilles comes here, but everything is all connected. So if we have tight fascia, it's gonna throw off our biomechanics. So we're just gonna come do a little bit of myofascial release down here. I'm also gonna do some instrument work on that heel. He doesn't have heel pain, but I just wanna knock all of this out of the way. That goes beyond treating the symptom and treating the root cause opposed to that symptom. Doing a little bit of instrument work to that heel. I just like to grip around the heel. Can you see this? Grip around here, and I just like to come at an angle, just like that. I'm not pressing extremely hard, just trying to loosen up some tissue. Scoot off of the table. Yeah. So let's go ahead and look at his dorsiflexion now after we hit the calf. So give me dorsiflexion both sides. So that's a lot better than what it is when he came in. So you see this? Yeah. So I'm also gonna hit the antib just to loosen that up a little bit. Okay, go ahead and scoot back.
What up?
I'm still gonna work on that plantar fascia to help with this big toe mobility. So I'm gonna get right up in here and I'm gonna do some passive movement. So as I go up the tissue, I'm just bringing that toe out with me to get it in a stretch position. This is fine on your Achilles, right? No pain with this?
Yeah, it's good.
Okay. Tickles? Sorry.
Feels like shockingly good.
Okay.
Someone like going at my toe with a metal thing.
Now I'm gonna hit this antib a little bit. So what I'm gonna have you do is give me some just up and down with your, yeah, there you go. As I glide up, he's just gonna give me some up and down movement, ankle dorsiflexion, plantar flexion. Give me some ankle circle. Some ankle circles. Yeah, just like that. Slow and controlled. Yeah. I'm gonna have him do like 6 to 8 that way, and then he'll do 6 to 8 the other way, just to get that ankle movement. I'm counting. Now go the opposite way. I'm just gonna do some voodoo flossing. This is a rock tape, so I like this brand really, really good. I'm just gonna wrap it around the Achilles, around the foot a little bit, and around the calf. All right, just gonna do a little bit of ankle dorsiflexion.
So is there anything that I can do to myself to help get this knot out?
Yes, you can get in there with a foam roll. The knot's gonna be there's gonna be a big difference after today because of everything that we did. But you can get in there with a foam roller or a lacrosse ball, but loading is your main thing.
So like actually exercising will help
yes, we're
work
gonna
the knot
exercise
out.
today too.
Okay.
Okay, go ahead and do that movement for me on your own a little bit. Yep. And that's pretty good ankle dorsiflexion compared to what it was when he came in. And then you can also do some ankle circles. Yep, just getting some movement up in there.
Other way.
Okay, get up and walk around a little bit and see how it feels.
It feels better.
Good. Better than when you came in?
Still feel a ball though.
Okay, we can do some cupping whenever we're done.
Should have shaved my whole leg. Should have shaved my whole leg for the cupping.
Oh yeah, because they fall off. It's all right, don't worry about it. Now we're just gonna go to the workout floor.
Whole calf.
The whole calf. Okay, we're gonna go back to the base. You going? Mm-hmm. Okay, so we're gonna go all the way back to the basics for this, just because we don't wanna stress or piss that Achilles off. So we're just gonna do basic, double. You can use this for balance. All I need is for you to come here and give me a normal calf raise. I want you to do like 10 reps. Let me know if there's any pain. If there's any pain in any exercise, we're gonna back off completely. Slow, slow, slow eccentrics. Pain with this, or you're good?
I'm good.
You sure?
Yeah, it's the ball.
The ball of your foot? Or the knot?
There.
The plantar fascia, yeah.
And the knot.
Another exercise that I want to do, it's not really like isolated Achilles, but it goes back down to the foot, because normally if the Achilles is off, it comes from a biomechanical issue if it's not a sports injury or if it's not like excessive running. So I'm gonna have him get this around here, close to the toes. What I'm gonna have him do, I have on toe spacers right now in my socks, but I'm gonna have, the first thing I want him to do, and this is just gonna work the arch, which is gonna help all of the biomechanics. As he was doing his calf raises, he had a little bit of pain in that plantar fascia. that can mean that his arch maybe is not activating right. So this is gonna help activate that. And the stronger your feet muscles are, everything else will fall into place. So it's gonna be here, okay? I'm gonna have him open his toes if he can, as much as he can, and grip the ground with all of his toes. His feet are gonna come into pronation, okay? And then he's gonna come out into supination. So they're gonna come here, supinate. Here, supinate. All my toes are open right now. They're gripping the ground. I overpronate a little bit on my right, so I feel it a lot in here, and that's the goal. That's gonna help his gait a lot more, and it's also gonna increase his big toe mobility, and he's gonna do 25 of those, okay? So, I want you to open up your toes as much as you can, okay? Hold on, not gripping yet, but open.
That's it.
That's it, all right.
That's all they do.
Okay.
Like,
Okay, now I want you to come out, and I want you to put all the weight just like how I was doing. No. So just let them pronate, let them rest. I want you to come out with them, okay?
Yeah.
Good, while keeping this big toe down on the ground. Go. Good. I need 25 of those.
I was doing it the whole time.
Try to keep these big toes planted. Planted as in here while you turn out. You feel this anywhere?
oh, I'm really, yeah, it hurts my feet.
Okay. So you feel your foot muscles being worked?
Yes.
That's a good thing, okay. Okay, so I'm gonna recommend toe spacers for you, okay? You don't know what those are, right?
No.
Okay, they're just, yeah, it's Amazon, they're like $7. You'll have them to you by like tomorrow. So they just go in between your toes when you're around the house, whenever you're not wearing shoes. So I'm really, really big on training.
Can't
like,
wear them to work.
that, no, obviously, right?
Here's a question.
Yeah, because you're in a shoe, right? But when you're at home, it's gonna help open up your plantar fascia. And the reason for that is, for one, the feet are the foundation of the human body. So if the foot biomechanics are off, everything's gonna be off. It's gonna throw the whole kinetic chain off. So the reason that I'm very, very big on bare feet and why you always see me working out without a shoe is because our foot, think of your foot as your hand, okay? This is my hand right here. Imagine if I had a glove on my hand that compressed me like this, because that's what our shoes do. They come like that. And I wore it all day, every day. All day, every day. The tissue is going to become used to being in that position, and it's going to cause your toes to come in, it's gonna cause you to overpronate, and it's just gonna throw everything off. So toe spacers are gonna be good for you. I'm gonna go ahead and tape that up, okay? So let's get you face down. How's it feel? Feels okay? All right. So this should last you about 3 days, okay? There's no need to take it off like when you shower or anything like that. Put him here. Actually, we're gonna move all of this. And I'm gonna have you scoop down.
Like, this way.
Right here, right here.
Good?
Right there's good. Alright, hold your foot up right here. Give me some ankle dorsiflexion. Yeah. I'm gonna put a little bit of a stretch on this. Not too much, just a little bit. trying to avoid any wrinkles here. Got a small one there, but that's okay.
Start hitting the legs again.
Yes, just don't do anything crazy. Like no jumping or running. I wouldn't recommend that right now.
But I got like hack squat and stuff.
Yeah, and you need to strengthen your calves. So you need to start incorporating those calf raises. Your foot. Yeah, a little bit of dorsiflexion. Boom, relax. Dorsiflexion, there you go. Therapy and also the corrective exercise treatment for Achilles tendonitis. This is also good for plantar fasciitis. Greg, go ahead and get up off the table, move around a little bit, see how it feels, see if it feels any different from what it was when you came in opposed to now. Do some squats, We gotta fix that squat, Get your feet apart.
Yeah, wow.
Put your weight on your heels. Lay back over here. Face up. And let's just see his dorsiflexion. Look at that. Huge difference from what it was whenever he first came in. And sometimes it just comes down to releasing that soft tissue and then correcting his movement pattern. So you should be good to go. Calf raises, slow eccentrics, single leg stabilization. I would stay away from running until there's no more aggravation. But yeah, you should be good to move. You have range of motion now. So that's gonna last for about 3 days, okay? It's rock tape, so it's probably gonna last for more. There's no need to take it off and re-put it back on. Yeah, it's only to keep the inflammation down. All right, sounds good.